We will access information for sure, but we need parents to be honest and open with us about the last time a child would have had an asthmatic episode or wheezing or any of those kind of things, chest tightness, those types of things we need to be aware of so that we can give a safe anesthetic on the day of treatment.
Hello, Dr. Johnson. Let's talk about the children who need anesthesia in order to get dental treatment done or to get it done more pleasant, more comfortable, which is, after all, an important thing, not just for children, also for adults. And children who have asthma. Tell us a little bit why for children with asthma or history of asthma would actually be benefiting from anesthesia as they do dental treatment.
Sure. Now, asthma is, I'm going to say, fairly common only because I see children with asthma several times a week. Diagnosis range from what they call a mild intermittent asthma to something that's moderate or more severe. And in each of these cases, it's a case by case basis. I determine which case I'm going to see. The child that has a mild intermittent asthma who probably only uses the inhaler, I don't know, 2 or 3 times a year is usually without an issue. There are others who are on 2 or 3 medications to control the asthma symptoms. And, and typically, parents need to know, or even adults as well, who may be seeking treatment. If you've had what we call an asthma exacerbation, or you've been wheezing recently within the last 6 to 8 weeks or so, typically what we would want to do is postpone treatment. I've had a child as recently as last week who I spoke to the parents previously. There was no mention of wheezing, but I interviewed them the same day of, and then they said, "Oh yes, 2 weeks ago he was coughing and they gave him an inhaler." I said, "Why did you give it the inhaler?" "Well, yeah, he was wheezing." Well, we had to postpone the case, and typically we do that because there's an inflammatory process going on in the lungs. And if we were to try to put that child to sleep, especially for a situation that is not emergent, we can have severe problems on the anesthesia or postoperatively. So we like to have these children without any symptoms at all for at least 8 weeks after their first set of symptoms appear.
Okay, so children should not have had for lack of a better word in my nomenclature for it, they should not have had a heavy attack in about 8 weeks.
Right, exactly. So, and anytime the questions are, when was the last time your child used the inhaler? Have they ever been hospitalized before for any asthmatic episode? All those are relevant questions that need to be asked. You need to examine the frequency of use of the medications that the child is on, because usually when you see 2 and 3 different medications, it's an indication sometimes of the diagnosis or the type of asthma that individual may be experiencing. And that, we need to be very careful, because if we have issues on the anesthesia, it really does complicate things for us and, more importantly, the child. So these are important things that parents need to share with us, this information. We will access information for sure, but we need parents to be honest and open with us about the last time a child would have had an asthmatic episode or wheezing or any of those kind of things, chest tightness, those types of things we need to be aware of so that we can give a safe anesthetic on the day of treatment.
Okay. Now, Dr. Johnson, thing I actually wanted to know, what you said is, of course, very important. What we talk about now actually make literally the first part is like, so why uh, does a child with asthma attacks need and should have anesthesia in the first place? Why is it beneficial for them? Well, maybe fit in a second question, which came up because of what you said, so that maybe you can answer it in tandem. And that is, if a child needs to be so long, weeks, many weeks, free of an attack, well, what about the child with has it much more heavy and almost frequently? You understand? Is it kind of
Very
like
good question. Very, very
very
good question. Yes. So a child with asthma, as any other child with any other condition, wants to be seen, needs to be seen in the office. That's not a problem. So it's not to say that the child with asthma has to specifically be put to sleep. No, we're just saying that incidentally, if you have a diagnosis of asthma, we just need to be sure exactly when the last asthma episode was so we can safely treat you. That's number one. Number two, if a child, as we understand, has frequent wheezing or asthmatic episodes or asthma attacks, however you want to frame it, what that suggests to us is that that patient is not well controlled and would need to be optimized with their primary physician before they can have any type of anesthetic in the office or anywhere else, for example. But the question will be, so what if they're okay for like 3 or 4 weeks and then they have it again? Then how are they ever going to get treated? Well, situations like that would often be referred to the hospital where the child will be best safely seen there, because if there was a particular issue and the child had to spend a night or two in the office, that's more appropriate for them to be in the hospital where they could have an overnight stay. In the office, that's not possible. But, there's always accommodation that can be made. It just may not be the office venue for that particular individual.
Okay, and that's why you need to know it. So
Correct.
basically, child with asthma, asthma in itself isn't the reason why they need anesthesia.
Correct.
They might just then have other anxieties
Right. It may be other things. Yeah. Yeah.
or need,
That way.
or need a lots of work. And it's just simply
Correct.
for millions of reasons why then this would be done just like with adults. Well, all right.
Correct.
And that answers this question. I think would be very helpful to listening. Thank
You're welcome.